Well, a new study confirms there is no link between vaccines and autism. The study was published in the journal Annals of Internal Medicine.
Danish researchers analyzed data from more than 650,000 children. Less than 1% of those who received the MMR vaccine were later diagnosed with autism. So that contradicts claims by anti-vaccination advocates. Dr. Sophia Dan is the division chief for general pediatrics at Cohen Medical Center, and she joins us now via Skype. Let us talk about this, doctor. Okay, so this new study, it's one of the largest ever done, and it shows that there's really no link between the MMR vaccine and autism. Just walk us through how the study was done and how they came to this conclusion.
Sure. Well, first of all, thank you very much for giving us an opportunity to talk about this very important issue. So what the study did was it looked at 650,000 children in the country of Denmark, and they followed them prospectively, meaning going forward. And they looked at what was the difference between the children who received the MMR vaccine and those who didn't. And like you said earlier, that there was no increased incidence of kids who ended up getting autism amongst those who had the MMR vaccine. But the study went a step further, and they went to look at specifically those children who had risk factors that might increase their risk for autism. And that might be sort of an older age of mom or dad, whether or not there were that child had any autism amongst his or her siblings, whether or not that child was born early, preterm, whether or not it was smoking during the pregnancy. So a number of these factors that have been associated with increased risk of autism. And importantly, amongst those children who are at higher risk, they also did not have a higher risk of autism after receiving the MMR vaccine. The authors further went on to just sort of make sure that around the time that kids get vaccines, that there isn't like a higher chance of getting autism compared to other time points. And again, they looked at that sort of time, or like, around the time that you actually get the injection. And again, they did not find a link. So that's another huge study that sort of contributes to all the existing studies that show that really that parents really can be reassured that there is not, that giving your child like the MMR vaccine will not increase their risk for autism.
So, doctor, with all of the studies that you've cited, one thing that's always been confounding to me is, and I brought this up to Anne-Marie in the past, I was on assignment in Africa for many years, and I was in a country that was one of only 3 countries that still had polio at the time, which was Nigeria, and I would meet families who only wished that they had access to the vaccinations that Americans and Westerners have, so that they wouldn't find themselves in this position with their children and their loved ones. Where did this rumor, this falsehood first come from?
So this association, this fear, started when a physician named Andrew Lancet, who published a study that involved only 12 kids, and found that he found that there was an association between the MMR vaccine and an increased risk for autism. Now, what we later find out, again, we're talking about 12 children, but it was published in a prestigious journal many decades ago. But what we found out later was that he was actually funded by a law firm that was intending to sue the MMR manufacturers. And then we find out that he actually altered and misrepresented the information on those 12 children in that study. So subsequently, he lost his medical license. And in 2011, the journal Lancet retracted the study, saying that it was false. But unfortunately, the damage was done, because then you had this, this one study circulating out there that could then stoke the fears of parents. And I think what's unfortunate is that we give the MMR vaccine around the age of 12 to 15 months, and then we give a booster shot around 4 years. And autism, usually you may see some subtle findings before that time, but typically the signs of autism come out around that 18 to 24-month period. And so I can understand why, like, parents then say, well, I got the vaccine a few months ago and now my kid has signs of autism. Like, there must be a link, especially when there's all of this sort of like mythology out there in the media or in social media that this link exists.
That's what I was going to sort of ask you about, doctor, because, there's the study that has been debunked and this sort of raging conversation, but for parents who look at their children and say, there's a difference in this child. This child is not the same. There's a lot of anecdotal stories as well. So what do you want parents to know about the risks moving forward if they choose not to vaccinate their child versus the risk that they think is present with a vaccination?
So your question is like, how do we talk about this with families, right? So usually how I approach this is, there have been hundreds and hundreds and hundreds of thousands of children that have been looked at and studied to see whether or not that risk exists. And there really has been shown no link. And while there are stories that circulate that children sort of seem to show signs of autism after an MMR vaccine, it's precisely because of that reason of the timing of when we typically give that vaccine and the timing of when autism typically presents. Now, just a few weeks ago in my large practice, we had a measles scare, and there was a child who was unvaccinated who was playing with another child who was unvaccinated who ended up having measles. And that child was seen in our practice. And so very quickly, we had to sort of track down who are all the potential children that were sitting in that waiting room for the several hours that happened, for the, I think, for the 6 hours or even more before that child even showed up, and for the hours after that, who came into contact in our practice. And that was frightening because we have seen measles in this country now, and now there's outbreaks all around the United States. And that can be a deadly disease. And I just think and so this is kind of how I talk to families, that children who aren't getting their vaccines are at so much risk right now of getting these diseases that we haven't seen. And we're seeing so many more cases of them, just like you said, polio, measles.
Right, exactly. Don't get a vaccine, you're at an increased risk of disease. Do get the vaccine, you're not at an increased risk of autism. That's sort of the bottom line.
Exactly.
Dr. Dan, thank you very much.
Thank you.